A 10-year-old boy comes to the physician for a yearly checkup and has a family history of early sudden cardiac death, and an older EKG shows ST segment elevation in V1 to V3. What are you most likely to hear on exam? A. Harsh whole systolic murmur, split during inspiration, diastolic decrescendo murmur, or exaggerated split during inspiration. So I'll let you answer the question and then I'll explain. So this patient's going to have a exaggerated split during inspiration, so D. So this patient has Brugada syndrome, and it's going to be an autosomal dominant condition, and that's why his family members also had it. So for this syndrome, you can have a right bundle branch block, and this causes the pulmonic valve to close slower. And so, or it takes longer to close because you have more blood coming in. So to talk about that, we'll talk about a normal inspiration. So during inspiration, you have venous return increase because you're increasing the thoracic cavity. And so this causes increased venous return, and that's going to cause the pulmonic valve to take longer to close. And so this causes a split in the heart sound because it's going to usually close at the same time, the pulmonic and aortic, but because now you have more blood in the right ventricle than the left, it's going to, the aortic is actually going to close faster than the pulmonic. And so now you have a split in S2. Now, with that being said, when you have Brugada syndrome, you're going to have a right bundle branch block. So now it's going to be exaggerated, right? Because it's going to take the pulmonic valve even longer to close because now the right ventricle doesn't work as well anymore because there's this right bundle branch block, which hurts the electrical system of the right ventricle, interfering with its ability to contract forcefully. So that's going to cause this normal split that occurs with inspiration to become exaggerated. And a similar condition that can cause this is pulmonic stenosis because it causes the same thing. You're going to have that split during inspiration, but with pulmonic stenosis, now it's going to take even longer for the pulmonic valve to close, and so you'll once again get this exaggerated split during inspiration. Now for the other answer choices, we have a harsh holosystolic murmur that can be heard during a ventricular septal defect. So if you think about it, there's just a big hole in the ventricle, in the septum of the ventricle, and so if you have blood going through there, because it's not supposed to go through there, it's going to cause a lot of turbulence, and that turbulence is what causes this murmur. And then for the final one, aortic regurgitation, we're going to have a diastolic murmur because the blood goes out from the left ventricle out through the aorta, but then because the aortic valve is weak in this case, it's actually going to let blood back in. Typically that doesn't occur, but now since blood can get back in, now you are going to hear that diastolic murmur because it's going to come in after systole, and so hence it'll be a diastolic murmur. And then the final answer choice was just the split during inspiration, which is normal, as I covered. So for this one, you had to recognize the family pattern, so hinting towards Brugada syndrome, and also seeing that ST elevation, which can be seen alongside right bundle branch block. And so knowing all of that and knowing the normal physiology of increased venous return during inspiration, you would know about this normal split of S2, and then you would know that with this right bundle branch block, you'd get an exaggerated split. So I hope that helped, and thanks for watching.